October. Yes, we are getting ready to turn that calendar over to another month. The weather will eventually, right, follow along. Changes coming our way, meaning those seasonal illnesses not too far away, Liz.
But Matt, we've already seen and heard some of the sniffles around, so now is a crucial time to visit your primary care provider to figure out that best plan for you and your health. That's why Matt Venezia is live at the Baton Rouge Clinic this morning to help ask some of these questions about when and where these resources may be available.
Exactly right, Liz. You know, it is that time of year, right, where we want to have this conversation with your physicians, you know, when you're making those annual appointments, maybe just coming in to have a conversation here. So Dr. Rolfson here with the Baton Rouge Clinic joining us here now. So maybe just a general kind of a question here. When it comes to flu, COVID, things definitely going around. You mentioned in the previous half hour that you've noticed an uptick here at the clinic in particular. For families just wanting to stay on the best defenses possible, what would you recommend?
Well, like you said, be aware that, and in particular, we see flu and COVID peak right around October, November, December with all the family gatherings, right? Thanksgiving, Christmas, we see a lot coming on. Part of that is, you know, someone else, so they give it to you when they cough or breathe on you. So if you have a cough, cover your cough. Don't cough in someone's face. Certainly prevent ahead of time by getting the vaccines, COVID or flu vaccines. Those are very safe and effective. The other thing is the virus kind of enters your body through either your eyes, your nose, your mouth. So, you know, wash your hands. If you shake hands with someone who has a virus, and then you rub your eyes or you touch your nose, your mouth, you can transmit the virus that way. So careful hand washing. Prevent the disease by getting the vaccine, and if you're sick, don't go around other people. You know, don't spread the virus. That's important.
It's definitely important to keep note of all that. Do you need to quarantine as much? Is it that much? Are we at that point right now? What would you say to if you are sick, just keep it to yourself? What's the best recommendation there?
That's a good question. It's interesting that we never worried about quarantine before. When you had the flu or any kind of cold virus, you just still go out in public and not worry about it. COVID made us much more aware of the fact that these diseases are transmissible to other people. So it's important that if you think you're sick, don't go around other people. So certainly quarantine. And generally, a general rule is a febrile for 24 hours. We tell kids that going back to school all the time. I think for adults as well, if you don't have fever for 24 hours, you're probably safe. There's some other guidelines for COVID, but basically no fever, 24 hours, you're probably okay to go back around people.
Lots of really important updates, things to keep in mind here. We appreciate the update here all morning long at the Baton Rouge Clinic. Thank you so much, Dr. Rolfson, for that. And with that, guys, we'll send it back to you.